And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, good morning and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, joined in studio by Dr. Fadi Tarazi from False Creek Healthcare Center. Dr. Tarazi, welcome to Boomer Life, sir. Good to meet you.
Nice to meet you. Thank you for having me.
It's my pleasure. You are an orthopedic surgeon. What is an orthopedic surgeon? What sort of surgery do you do?
Orthopedic surgery is basically surgery of the musculoskeletal system, which is the bones, the muscles, joints, and ligaments of the body.
Okay. Did you always want to be an orthopedic surgeon? Did you go to medical school going, I'm going to be an orthopedic surgeon? Have you always had that focus in your career path?
When I first went into medical school, initially I wanted to be most likely a cardiac surgeon.
Okay.
Because I wanted to do something manual.
So it was surgery. It was always a surgery of some kind.
Always surgery.
Okay.
And then soon after I started, I found that orthopedics fit me more because it was more variety of surgeries dealing with different joints. And I found that this would fit more my interests.
Interesting stuff. Now, you're a Montreal guy. We went to McGill Medical School. Yes. You've also you've been in Oklahoma City, and you worked in Toronto as well. Where did you learn your orthopedic specialty?
The orthopedic specialty was at UBC in Vancouver.
Okay.
At the UBC system, including VGH, UBC Hospital, and the different teaching hospitals.
So are you one of those Eastern guys who came out to Vancouver to go to school and never left?
Basically. That's the joy of Vancouver.
Well, it sure is. I came out here a whole long time ago, and I haven't been back a whole bunch either, and I can certainly understand that. So, False Creek Healthcare Center and orthopedic surgeries. Talk to us about how the two connect.
So, basically, when I first started practice, False Creek Surgical Center had just opened as well.
Okay.
And I had some cases where I needed to do workers' compensation board cases, work injury cases, surgeries. So that's where I started working over there, and it's been 15 years later. I'm still there.
So you're one of the original guys from False Creek Healthcare Center.
Within the first few months after they started.
Interesting stuff.
I joined in.
And now, we've talked about this in terms of the relationship between workers' compensation and False Creek. It's an ongoing situation. So if you're injured on the job and break a bone, it's likely you're going to see Dr. Tarazi.
If they show up over there at False Creek Surgical Center, yes, I will most likely be seeing them.
And what sort of workplace accidents do you encounter most frequently, Doctor?
At False Creek Surgical Center, most work injuries are through the construction business. There's a lot of construction zones around the downtown core, and a lot of these injuries, as soon as they occur, the injured workers will be brought to False Creek Surgical Center.
Oh, so they're right from the job site right down to False Creek Healthcare Center.
Yes, and sometimes we have patients being referred from their family doctors to the center with work injuries as well.
Okay. And now I note also from your extensive resume that you've got a little bit of athletics in your background. You were the team doctor for the Vancouver Ravens of the Lacrosse League and also for the Vancouver Canadians baseball team. So you've got a lot of sports injuries in your background as well.
Yes. When I was in Oklahoma City, I did a one-year sports medicine fellowship training in shoulder and knee athletic injuries, and that has carried through into my practice as well. So initially, when I first started practice, it was with the Vancouver Canadians at Nat Bailey Stadium.
Of course.
When they were the farm team for the Oakland A's.
All right.
And then there's the Vancouver Ravens of the National Lacrosse League.
Well, I played a little lacrosse as a kid in Ontario, and I'm willing to bet there are more lacrosse players bashed up than there were baseball players who ended up on your operating table.
Absolutely.
That's a rough sport.
Very rough.
And so now we'll talk about the various types of injuries, upper and lower body, as is the popular vernacular in sports these days. Nobody has a bad knee anymore. He has a lower body injury. Have you noticed that over the years?
They always want to hide what type of injuries in hockey.
That's exactly right, because they don't want the other guys to know what the weak spots are, right?
But most likely it is the knee.
Okay.
In the lower body. And most often in the upper body, it's a shoulder.
When you, as an orthopedic surgeon, see someone, is it typically because of a workplace-related or sports injury, or do people who just encounter bone deterioration, for example, also end up on your client list?
Most often, it is a sports-related injury.
Okay.
And we also see a lot of degenerative problems such as shoulder rotator cuff pathology or cartilage tears in the knee or arthritis in the knee. All those problems show up quite frequently in my office for surgical treatment.
This program is called Boomer Life. And so obviously now we're talking about a specific group of people, the 1946 to 1964 crowd, quite specifically. Okay. And as we age, you've already mentioned the word deterioration. It's not a word many of us are comfortable with, Doc, but it's a fact of life, isn't it?
Absolutely.
So as we get older, what's most likely to go first?
Generally, we see the most common is in the knee. The knee often goes first. There seems to be a lot of mileage on the knees.
Right.
And they deteriorate. They get wear and tear changes in the knee. And the cartilage gets thinned out. They start having pain. There's also very common to tear the cartilage, which is called meniscus in the knee joint. And that often requires surgical treatment to take out the torn piece of meniscus. So we see a lot of patients with knee complaints.
And these aren't sporty types either. These are just people, well, going through their normal daily activities, right?
Absolutely.
So in addition to knees, which it appears are likely the first to go, what other common complaints do you hear from boomers these days?
The shoulders is second.
Oh, is that right?
Second.
And I must add very quickly here, friends, both Dr. Tarazi and I are charter members of the Boomer Club. So we're talking about our peers in many ways, aren't we? So shoulders, what happens with shoulders? What do we do? What goes wrong there?
So shoulder, it's less common the arthritis.
Oh, of
it's
course.
more common the tendons and muscle problems in the shoulder. So people get rotator cuff tendinitis, bursitis, or rotator cuff tears. The rotator cuff is basically the muscle sling of muscles all around the shoulder joint that operate the shoulder.
Right.
And they deteriorate and get thinner and start gradual tearing. And eventually, once it fully tears off of the bone, then they get pain.
I had a personal experience. I had some rotator cuff issues that I ended up going to a registered massage therapist for, and he gave me some exercises to do and all the rest of it. And I learned in the process of rehabilitating my right shoulder that a lot of these deteriorations of age are caused in many cases by bad posture, among other things, can really accelerate deterioration.
Absolutely. Bad posture does accelerate deterioration because it puts you in awkward positions where the joints and the muscles are not accustomed to operate.
Right.
So that's what puts them at a higher risk of being injured, sprained, or more likely to tear.
And one of the causes of bad posture is inattention. And a lot of that is caused by stress. We're so wound up and worked up about just getting through every day, we neglect the basics like standing up straight. It seems so ridiculously easy, but that's what I went for a few sessions and had the massage thing, and I got my little stretchy exercise thing. But the bottom line was, stand up straight, man. Put your shoulders back and just relax a little bit. So a lot of what you encounter is stress-related in one way or another, isn't it?
It is very common, yes.
And how does it manifest itself?
It manifests basically pain. They present with pain.
Right.
They can present with pain plus stiffness in joints, especially in the shoulder. So a lot of patients present with rotator cuff tears and frozen shoulder at the same time. So they have very limited range of motion in their shoulder. They have difficulty lifting their arm up in the air, and that results in functional disability. They are not able to use that arm.
Okay. Now, when and we'll talk a little bit later and more extensively about sports injuries, but I would assume that a professional athlete who is injured in a sporting event receives, though, at False Creek Healthcare Center, precisely the same treatment and attention that a person who was injured on the job or a person who came in off the street would receive, correct?
Yeah, we treat all comers equal.
Yeah. And that's something that False Creek Health Care Center is somewhat legendary for. Now, you're part of the original wave of doctors that staffed False Creek, and so you've been there for 15 years, and that has been the pervasive ethic for that entire time. Everybody gets treated equally.
Yeah, everybody has their own spot.
Right.
We treat them.
And now you also practice sometimes at Burnaby General, correct?
Yes, I do.
Interesting stuff. So how do you divide your time? How do you, because you've been at False Creek for so long, how long have you been at Burnaby General?
Same amount of time.
Oh,
Since I came back from Oklahoma City, I've been at Burnaby and
False Creek. So this dividing the time thing is old hat for you.
Yes, right from the beginning.
Oh,
so I started out Burnaby Hospital from the beginning, and I spent about a day and a half a week at Burnaby Hospital, and 1 day at False Creek Surgical Center, and the rest of it is I have an office next to Burnaby Hospital where I spend the rest of the week there.
When you went to Oklahoma to take your sports medicine fellowship, what was the most important thing you learned, or the thing that surprised you the most about athletes and the way they hurt themselves?
Athletes are getting more and more aggressive at their sport.
Yes.
The demands placed on them by their coaches, by the sports programs in the schools are much, much higher, and there's no downtime. So there's no rest time. They just keep going at it, and that's what places them at more risk.
And I wonder, because we know that False Creek Healthcare Center sees patients of all ages, and I'm thinking now in terms of those injuries that you've just described, from coaches and athletic directors demanding more and more aggression, thereby resulting in more and more injuries, that also probably is starting to happen at a younger age level too, at the high school level, for example.
We see that at any level. These days, even in high schools, elementary schools, because kids want to make the team.
Sure.
They don't want to be left out. So the only way to make the team is to play at their maximum capacity.
Just go all out.
Puts them at risk.
Right.
Now, the injuries that elementary school students get are less severe.
Sure.
As they get older, they're more and more severe.
Well, you get into your teen years, and suddenly there's not a lot of difference between a 9-year-old and an 11-year-old, but there's a lot of difference between a 14-year-old and a 16-year-old, and sometimes they meet on the playing field to the disadvantage of the 14-year-old.
Absolutely.
So, but that's the imbalance that in the teen years can create in terms of size, let alone anything else.
Yes.
So what are the most common kid injuries that you see?
We see ankle sprains, we see knee sprains, and wrist injuries, falling on a wrist.
Okay. Now, these would seem to me to be not the sort of thing that require some surgical intervention. If you have a sprain, generally, as I recall, I've had a sprained knee from hockey a couple of times. I had a brace put on it. I was told to be kind and gentle to my knee, and that was about it for 6 weeks, and crutches.
Yeah. Well, in elementary school age, that's what you get is mostly sprains. But as the kids are getting older, then you start seeing the fractures, you start seeing the ligament injuries that require surgery.
Okay.
Such as anterior cruciate ligament injuries in the knee or
ACL,
shoulder dislocations.
Right. And I'm sure, and this is just a note for parents and grandparents, if a childhood injury is not properly addressed in childhood, it can linger and become infinitely more complicated in adult years, correct?
Yes, it can. Because that's how you get the wear and tear as well. If injuries are left untreated or uncorrected, it can lead to arthritis down the road.
Right, so all the more reason to attend to those things. And guys are particularly awful at this, Dr. Tarazi. Yeah. Well, just suck it up, princess. Live with the pain. That's what tough guys do, and all that malarkey. It doesn't help, especially if you're a young guy, because it could come back to haunt you.
Absolutely, because they don't want to take the time to do the surgery and recover from the surgery.
Right. They
don't want to miss a beat.
That's right. They want to make the team. Our guest on Boomer Life today is Dr. Fadi Tarazi from False Creek Healthcare Center. We're talking orthopedics and surgical procedures. We're going to learn about the famous Tommy John surgery on the program today. That is guaranteed. And there's lots more still to come after this quick timeout.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.